health alert now. Virginia health officials are sounding the alarm after confirming the second case of measles in Virginia. 8 News reporter Sarah Molina spoke to a doctor about this threat. She joins us live in studio now with what you need to know. Sarah, good evening.
Eric, good evening to you. That's right. On Friday, the Virginia Department of Health announced that a teenager between 13 to 17 years old recently traveled internationally and spent several hours in Charlottesville before being diagnosed with measles. Now, I spoke with Virginia's former health commissioner, and he tells me that the number of measles cases across the country are the highest they've been in more than 5 years.
Something's going on where we're seeing more measles cases, and the likely explanation for that is children not being vaccinated.
Former Health Commissioner of Virginia, Dr. Randy Gordon, says in the U.S., 1,200 cases of measles have already been reported so far in 2025, a stark contrast from recent years.
Most years it's been less than 100 since the mid-90s. So for the most part, we had measles under control.
But now the illness has made its way to Virginia a second time, with the VDH, or Virginia Department of Health, announcing Friday that a teenager who spent time in Charlottesville was diagnosed with the highly contagious disease.
If you don't have immunity and you're coming to an area where someone who has been infected and is spreading the virus, the chances of becoming ill with it are not in your favor.
Gordon says the airborne virus lingers in the air for some time, but it can also be picked up from surfaces too, which is why the VDH is warning people who may have visited any of these 5 locations to monitor their health. The exposed teenager visited these areas between Tuesday, May 20th and Friday, May 23rd.
It's like a common cold, runny nose, sneezing, cough, fever. Those are the first signs and symptoms. So you may not know that you have it initially, and you usually get that 1 to 2 weeks after exposure.
But Gordon says after that, symptoms worsen, including a rash that spreads to your whole body.
The CDC recommends that everybody get 2 vaccinations.
Now, if you believe that you may have been exposed to measles, the VDH says to monitor yourself for symptoms and to self-isolate. For more information on the vaccinations you need for immunity, visit WRIC.com. Reporting live in studio, I'm Sarah Molina, 8 News.